Chronic bronchitis. As I mentioned, chronic bronchitis is diagnosed clinically. It's defined by the presence of persistent productive cough for at least 3 consecutive months in at least 2 consecutive years, which means that any patient who had productive cough ل3 أشهر متتالية خلال 2 سنتين متتاليتين يشخص بأنه عنده chronic bronchitis بدون الحاجة لأن نعمل أشعة أو فحوصات مخبرية. It's common among cigarette smokers, and studies show that 20 to 25% of men in the 40s to the 65-year-old age group have this disease. In early stages of the disease, the cough raises the mucoid sputum، يعني الcough بيطرد هذا السبيوتم so the airflow is not obstructed. Heavy smokers develop chronic outflow obstruction. Usually this is related and associated with emphysema COPD. Some patients with chronic bronchitis have evidence of hyperresponsive airways and intermittent bronchospasms and wheezing. This is what we call asthmatic bronchitis. At the other end of the spectrum, patients may present with emphysema and pronounced chronic bronchitis along with history of recurrent infections. In such cases, patient has less dyspnea and absence of increased respiratory drive. So the lungs retain carbon dioxide, resulting in more hypoxia and cyanosis. For unclear reasons, such patients tend to be overweight or obese and called blue bloaters. Blue because of the carbon dioxide retention, cyanosis, and hypoxia, and bloater because most patients are overweight.